In this video, I'm going to show you how I fixed 5 years of chronic back pain, lost 48 pounds, and got my life and freedom back. I spent 5 years trapped in chronic back pain, gaining nearly 50 pounds, barely able to get out of bed, trying everything the doctors told me to try. And you know what finally worked? Doing the exact opposite of what every specialist recommended. See, at 19 years old, I herniated 2 discs in my spine. The diagnosis was brutal. L4, L5 herniation, bulges at L3, L4, L5 and S1, mild scoliosis, and a lateral pelvic tilt. But here's what nobody tells you about chronic back pain. It's not just your back that breaks, it's your entire life. And the solutions out there, most of them are designed to keep you coming back, not to actually fix you. Let me paint you a picture of where I was. I had a girlfriend, now my wife, who watched me transform from this confident, active guy into someone who couldn't even sit through a movie without wincing. I put on weight, I was agitated the whole time, angry. I was slowly snowballing into depression. I had dreams of joining the military, and suddenly I couldn't even walk upstairs without my back screaming at me. So I did what you've probably done. I trusted the system. Physiotherapy, tried that. Steroid injections, I've tried that. Painkillers, yoga, Pilates, stretching, chiropractors, osteopathy, massage, acupuncture, you name it, I've tried it. I've read every book, downloaded every single app, tried cognitive behavioral therapy. I even bought one of those inversion tables, spent a fortune on decompression therapy. And here's the thing that will make you angry. Most of it worked temporarily, but that's when it hit me. They weren't trying to fix me. They were just trying to manage me. They were just trying to give me enough of a temporary fix to keep me hooked, to keep me coming back. Think about it like this. Imagine your car's engine is misfiring. Now you go to one mechanic and he says it's the spark plug, so they replace those. Another says it's the fuel system, so they clean that. A third says, oh, I know exactly what it is. It's the timing belt. Each one fixes their own part, but your engine, it still runs rough because nobody's looking at how all of these systems work together. And that is exactly what's happening with back pain treatment. A 2017 study in the Journal of the American Medical Association found that most back pain treatments focus on only symptom management rather than addressing root cause issues. The bottom line is the system isn't built to cure you. It's built to keep you coming back time and time again. So here's a question for you. What if the reason nothing's worked so far isn't because your back is broken beyond repair, but because you've only been attacking the problem from one angle at a time? See, after 3 years of this cycle, this pain cycle of doom, as I call it, I was done. I was finished. I was ready to accept that this was just my life now, but something kept nagging at me. I spent thousands and thousands of my own money seeing different specialists. The physio would tell me one thing, the chiropractor would contradict them. The osteopath had a completely different approach, and they all acted like their way was the only way. But what if they were all partially right? And that's when I had my breakthrough moment. What if I stopped thinking in terms of, well, it's this treatment or that treatment, and started thinking this treatment and that treatment? See, that's what the research actually shows. A 2016 systematic review in the Cochrane database found that multimodal therapy, that's fancy talk for combining multi-treatment approaches, was significantly more effective for chronic back pain than single interventions. The mega wealthy athletes and celebrities, people like Tiger Woods, they don't just see one person, they have entire teams, a physio and a nutritionist and a sports psychologist and a massage therapist. They're using what I call the recovery matrix. Here's another way to think about it. Imagine trying to get out of debt, but only cutting your grocery bill. Sure, it helps you a bit, right? But you're still spending on rent, maybe your car payment, subscriptions, eating out, everything else. You might save a few dollars, but you're never getting ahead. That is what single treatment approaches do for back pain. Your chiropractor adjusts your spine, but ignores the inflammation from your diet. Your physiotherapist gives you exercises, but doesn't address the pain psychology that's keeping your nervous system on high alert, that's keeping you tight, that's pulling at your muscles, that's giving you that nagging pain. Your doctor prescribes painkillers, but that doesn't help you build the strength to support your spine long term. Ultimately, this means that you get some small improvements that never really add up to real freedom. You're only attacking 10% of the problem, while the other 90% keeps you stuck. So I became my own recovery scientist. I started putting the best, most evidence-based practices from every discipline, the mobility work from physiotherapy, the spinal alignment principles from chiropractic care, ones that I could actually do myself rather than paying a chiropractor week in, week out, the pain science and the psychology from cognitive behavioral therapy, the recovery protocols from sports medicine, the anti-inflammatory approach from nutritional science, the decompression techniques that actually work. And I built my own system, my own recovery matrix. And the results? They gradually came at first, but then they came all at once. I started noticing I could move differently, sleep better, think clearer. The weight started coming off, not because I was starving myself, but because I had the energy to actually move again. Because I wasn't just medicating my emotions with food anymore. What activities have you stopped doing? Maybe it's just playing with your kids on the floor. Maybe it's hiking or golf or just being able to sit comfortably at the dinner table with some friends or family. For me, it was all of that. And slowly I got it all back. Eventually, I actually got to the point where I felt better than I had before the injury. Not just pain-free, actually strong, confident, and capable. But here's what I want you to think about. What would getting your life back look like for you? What's the one activity you do first if pain no longer was holding you back? What kind of version of yourself are you working to get back to? Maybe the version before back pain hit you. Or maybe you have in your mind a much better version of yourself to accomplish some sort of goal that you've had to put off because of your chronic back pain. Knowing that everyone's end goal is different, the process of getting there follows the same principles. Address everything, not just one thing. And most importantly, address the right thing that's relevant for your back pain recovery. Now, I'm not special. I didn't have some sort of magic genetics. A 2018 study in the Pain Medicine Journal found that patients using integrated, multidisciplinary approaches reported significantly better outcomes than those using single treatment methods. And the science backs this up. Your body isn't just physical. Your pain isn't just physical. It's neurological. It's psychological. It's influenced by your nutrition, your mechanical movements, the psychological beliefs that you have about yourself and about your pain. It's the influence that nutrition has on your pain. It's your biomechanics and how you move your body. It's everything together. And when you treat it like everything, that's when things change. Look, most people stay trapped because they're playing by someone else's rules. They're stuck in this kind of cycle. They see the doctor, they get a prescription, temporary relief, pain comes back, repeat. But it's not your fault. That is by design. But there's another way. There's a group of people, and maybe you're about to join them, who take control of their own recovery, who say, I'm not going to be dependent anymore on weekly appointments for the rest of my life. I'm going to learn and do exactly what my body needs to get out of chronic back pain. Most people think that their situation is uniquely bad, that their pain is somehow different to everyone else's, that what worked for someone else couldn't possibly work for them because their injury is more severe, or maybe because they're older, or because they've had it longer. But here's what is actually true. Pain is complex, yes, but the principles of recovery are universal. Whether you've had pain for 6 months or 5 years, whether you're dealing with a disc herniation, disc degeneration, or nerve issues, the fundamental problem is the same. You've only been treating parts instead of the whole. The real question isn't whether your situation is different, it's whether you're ready to try a different approach. And here's the truth that nobody wants to tell you. Recovery isn't finding about that one magic bullet. It's about creating a system that addresses all of the factors keeping you in pain. And yes, it takes work. It takes consistency. But it's work that gives you your life back, not work that keeps you on someone else's appointment schedule forever, spending thousands of thousands year upon year. The difference between where I was and where I am now, it isn't luck, it isn't genetics, it's just doing the right approach. So I stopped looking for someone to fix me and I started learning how to fix myself, and that's made all of the difference. Look, the bottom line is you've got 2 paths ahead of you. One path is staying where you are today, managing your pain, trying the next solution, the next 3 magical stretches, hoping that this time it will be different. And maybe that's a valid choice for you. The second path is about finding if there's actually a better way for your body and your specific situation. It starts by doing a clear assessment on understanding why it is that you're in pain. What has caused the root cause issue? What needs to be addressed? If combining approaches instead of isolating them could change everything for me, why can't it for you? There's also going to be a link in the description for you to undertake a free quiz that's going to give you clarity as to what is causing the root cause of your back pain and the best path moving forward to ultimately address it. So the question is, are you going to be someone this year that actually addresses your pain, or are you happy staying on the hamster wheel of back pain and all of the negatives that brings? Maybe it's paying thousands for a chiropractor, not being able to do the activities you want, or are you going to investigate whether there's a better way of solving your back pain?